Erica. I'll be your student nurse today. I'm going to go ahead and do a head-to-toe assessment on you if that's okay.
That's okay.
Just making sure this bed is locked and a good height. Perfect. So, could you please tell me your name,
Juan Fonseca,
your date of birth,
July 24, 1995.
and do you have any allergies?
No.
Nope. I'm just going to verify this on your wristband. Perfect. Alrighty. Now, are you experiencing any pain right now?
No.
Can you rate that on the scale from 0 of no pain to 10 being the most pain you've ever felt?
0.
0. Excellent. I'm going to go ahead and transition into your vital signs. I'm starting with your temperature. Your temperature is within the normal range, 96.6 to 99.5. Your respirations are within the normal range of 12 to 20 beats per minute. Your heart rate is within the normal range, 60 to 100 beats per minute. And I'm going to go ahead and check your blood pressure. Do you have a preference on which arm I use?
This one's fine.
Alrighty. Your blood pressure is within the normal range, less than 120 over less than 80. Really quickly, I'm going to check this pulse ox. It's within the normal range, 96 to 100. I'm going to go ahead next and help you transition to the end of your bed. Alrighty, and while we're here, I have a few more questions to ask you. Could you tell me what year it is?
2020.
Awesome, and why are you here today?
Just my yearly checkup.
Yearly checkup, perfect. And where are we at right now?
Gulf Fire Hospital.
Perfect. All right. So I'm gonna go ahead and shine this light in your eyes. It's gonna be pretty bright, but just look straight ahead at me. Alrighty. So your pupils are equally round, reactive, and accommodating to light. Your pupils constricted from a 5 to a 2. I'm going to ask you to go ahead and push down. Thank you. Push up. Awesome. And while we're here, I'm just going to take a peek at the skin turgor. That looks great. I'm going to check your hands one more time. I don't see any signs of clubbing. Alrighty, and that cap refill is less than 2 seconds. Next, I'm going to go ahead and listen to your lungs. So each time I place the stethoscope on the skin, can you please take a deep breath in and out of your mouth? I'm going to listen for a full respiratory cycle in each placement. Perfect. I'm going to come over here. Posteriorly, I'm going to listen in an hourglass shape and avoid your scapula and the vertebrae. And then I'm going to come over here and listen to that right middle lobe. Perfect. Alrighty. And next I'm going to go ahead and listen to your heart. I'm going to start in the second intercostal space, right sternal border for the aortic. Second intercostal space, left sternal border for the pulmonic. Third intercostal space, left sternal border for your Erb's point. Fourth intercostal space, left sternal border for your tricuspid. And your fifth intercostal space, left midclavicular line for your mitral. And go back through each of those to listen to any bruits. So I didn't hear any bruits or abnormal sounds with your heart. I didn't hear any abnormal sounds like crepitus with your lungs. So that was all great. I'm going to go ahead and have you transition to laying back down. Next, I'm going to go ahead and take a look at your abdomen. Could you tell me when your last bowel movement was?
Like 2 hours ago,
Alrighty, and your last meal?
40 minutes ago.
Perfect. I'm going to check. On inspection, there's no distension. I'm going to go ahead and take a listen starting in your right lower quadrant. The ileocecal valve is located in this region, so it should be most active. I'm listening for about 5 to 15 clicks in each region. Moving up to the right upper quadrant for 5 to 15 clicks, left upper quadrant for 5 to 15 clicks, and left lower quadrant for 5 to 15 clicks. Everything sounds great. And next I'm going to go ahead and feel your pulses. I'm going to start with your carotids. I'm doing these separately. Then I'm moving to your brachials. The carotid pulses were 2+ bilaterally. The brachials are 2+ bilaterally. The radials are 2+ bilaterally. Feeling the femorals next. And they are 2+ bilaterally. Moving to the popliteals. Two plus bilaterally. Down to the posterior tibialis. These are 2+ bilaterally. To the dorsal pedis. 2+ bilaterally. While I'm down here, if you could go ahead and push on my hands. Perfect. Push up. I'm gonna check for any signs of breakdown. No signs of breakdown, skin breakdown indicated. No signs of edema. Skin is warm and dry to touch. I'm gonna go ahead and foam again. Alrighty, so I have concluded your head to toe assessment. Make sure your bed is low and locked. Here is your call light if you need anything. I'm gonna go ahead and check in with your nurse. And I'm foaming out.